歡迎大家出。
Welcome to the press briefing. We have Dr. Albert Au, Principal Medical and Health Officer of the Center for Health Protection, and Dr. Harry Lee, Hospital Authority Chief Manager. Dr. Au will first give you an update on cases. Good afternoon, members of the public and the media. I would like to report on the latest information about COVID-19 cases yesterday. Yesterday, for locally infected cases, 1,160. Of those 456 PCR positive cases, 724 are RAT positive cases that have been verified by further PCR test. And then yesterday, there are 116 imported cases. So far, for the fifth wave of the epidemic, Hong Kong recorded 1.212777 million positive cases. Of the 116 imported cases, 56 were detected through positive testing at the hospital, at the airport, and 44 cases were tested positive during hotel quarantine, and 16 cases tested positive after 7 days of quarantine. So there's been no new death cases so far. For the number of death cases in the fifth wave, it remains at 9,180 cases. As for homes, yesterday there were 2 residential care homes for the elderly which reported new cases. One is a Yun Yun nursery home and day care home in Lei Mok Shu Estate. One resident was tested RAT positive on the 17th of June, and we found 5 residents who are close contacts, 4 workers also close contacts, so we've arranged for them to be quarantined. The other is Tung Wan Group of Hospital, Fong Wong Hun Tai Home for the Elderly. Yesterday, 1 resident tested RAT positive, and then this morning another 1 worker also tested RAT positive. The onset was this morning. And this care worker took care of the infected resident before. So in this home, 3 residents and 5 workers have been listed as close contacts. For the Christian Family Service Center, Shangcheng House, there are still for more cases. So far, 18 residents and 1 staff members have been infected. For schools, most schools, don't have classes today, so there are no new reported cases. Yesterday afternoon till this morning, 2 schools reported new cases. So there is suspected transmission in the same class. The first is Lok Yan English International Kindergarten at Lohas Park at Clay Street class. 1 teacher and 3 students, 2 AM class students and 1 PM class students tested positive. So we have suggested that this class be suspended for 7 days. The other is Porto Primary School in Hankono, Class 1E. 4 students have tested positive. So again, we recommend suspension of classes for this particular class. And then so far for the past week, there are 797 cases reported by schools. And in the previous week, that is the 4th to the 10th of June, 538 cases. So compared to that, the previous week is an increase of 48%. As for genetic analysis sequencing, we have identified 13 suspected cases of BA2.1.2.1. 2 local cases, 11 imported cases of 2 cases cannot be traced, and the 5 other cases are epidemiologically linked to these 2 untraceable cases. And then there's another case in Sham Shui Po, and then in Chim Chui, Sorrento, Tower 5, there's a family recording a total of 5 cases, and then the same development in the same tower, another floor, there's another case. So for the 4 for the 4 of the cases, they are epidemiologically linked to earlier cases. One is related to a case in Wan Chai Changheng building. A few days ago at this building, there was a case. And then 3 cases linked to the Central Kowloon Route site at Fat Kwon Street Home and Teen cluster. So far, there are 10 cases there. All are male, aged between 39 and 67. They have all received 2 or 3 doses of vaccine. 3 persons are asymptomatic. 7 have onset between the 10th and the 14th of June. Of the 10, 8 are the morning shift workers. There are 2 new cases from the overnight shift. Yesterday, we have issued a compulsory testing notice, so everyone on that site has to receive a PCR test. Our colleagues inspected the site yesterday. We collected 9 environmental samples at the changing room and at the canteen, or at where they have meals, and all the samples tested negative. And yesterday, there's a new suspected BA.4 or 5 case is an imported case. Now, Dr. Larry Lee will give you an update on her hospital authority. So far 433 patients, confirmed patients are in hospital. 72 are new cases, and 115 are in isolation wards, 10 in second-tier isolation wards, 94 are in the North Lantau Hospital, Hong Kong Infection Control Center. 53 are newly confirmed cases. And 2 cases are critical. 2 have had vaccines, and we have no new reported critical cases since yesterday. And then there are 17 in serious condition, and 3 are in ICUs. In the past day, there's no death case, and in the past day, 51 patients have recovered, 42 have been discharged. And since the 5th epidemic, we have 51,187 patients who have recovered, and 50,810 have been discharged. And since early 2020, 63,567 patients have recovered, and 63,191 patients have been discharged. And then there are 3 patients who test positive upon admission screening. 4 patients in the same ward are listed as close contact. As for staff members, 23,822 confirmed cases. Out of those, 23,714 have returned to work. That's all from me. Okay, the floor is open to questions. Please first identify your organization before you ask questions. The gentleman in a white shirt, please. I'm from TVB. Now, from the cases, we see that in the past 3 days, each day the cases exceeds 1,000, and there are no clusters. So have you done any analysis? What sort of people mainly have been infected? Would there be any specific location or places? So have you identified any high-risk places, or there are new clusters? Second question. We see just 400 odd people are in hospital. So there are over 1,000 confirmed cases, and only 400 are in hospital. Does it mean for the remaining of the confirmed cases they are in home isolation? But would they meet the condition, that is, maybe if they don't have 2 bathrooms or they don't have a separate room, would there be prosecution if people stay in home isolation? And also yesterday there's now a police cluster. Are there any new cases involved this police cluster? And may I ask the Secretary whether you have information of a large police cluster or discipline service cluster? For example, more than 5 cases in a cluster, would you then be notified of that? Thank you.
Thank you for the questions. The cases stayed at around 1,000 per day over the past few days. For these cases, we conduct epidemiological investigations. We also look into their leave home safe records. When cases are at this level, there are outbreaks in different parts of the city. There are family clusters. There are also smaller scale transmissions at schools. There are also outbreaks at workplaces. We focus on key venues, high-risk venues, and pop groups. And our epidemiological investigations are focused on care homes, restaurants, and also bars where there are clusters. We also focus on the new mutant strains such as the BA.2.12.1 subvariants. We do a bit more investigation into those cases. There are cases found in different districts without any signs and cases concentrating in particular areas. In the city, there are cases rising in different parts of the city. Cases are also rising across various age groups over the past couple of weeks. There are more cases among the younger age groups. For over the past week or so, roughly 54% of the cases involve people aged 20 to 49. Among the elderly, 18% of them. There are 18% of them among the cases over the past week. There's a change from the previous times in the fifth wave. There are fewer members of the elderly affected and more younger people getting infected. We continue to monitor the epidemiological details of the cases. Now, that's the second question, the change of the questionnaire for the online platform. We want to step up the isolation arrangements for cases. For cases when they have a home settings that are not suitable for home quarantine or isolation, we try to arrange isolation facilities for them. This measure is meant to prevent transmission within a household setting and to minimize the transmission risks for family members, and also to reduce the transmission risks in residential buildings. After the revision to the questionnaire, more cases are found to have an unsuitable home setting, so these people have been arranged to go to the Penny's Bay isolation facility. We haven't found any cases of false declaration of details or withholding of information. Now, turning to the clusters in the police. Yesterday, we mentioned one cluster. The police have also made an announcement. This is under the operations wing of the police force. Up to now, we have 22 cases. We have also analyzed the genome sequencing. We believe this belongs to the BA.2.2 variant. That is the prevalent strain of Omicron circulating in Hong Kong. On Thursday, now based on the previous epidemiological investigation, we found a cluster. The onset dates were June 12th to the 16th. Most cases tested positive from June 13th to June 16th. 2 are asymptomatic carriers. As for the rest, had mild symptoms from June 13th to 15th. The first case was found PCR positive through compulsory testing at the building on June 12th. The colleagues of this person within the same unit have been arranged to do RT or PCR tests, and then more cases were uncovered. Our investigation shows that for the time being, in this cluster or in this unit, there are 130 to 140 officers. They have tested RT negative. Most have also undergone PCR tests. The results came back negative. 2 are pending results. The earliest case tested positive on June 12th. As for another case, the last day of work was June 11th and tested positive on June 15th. We believe the transmission happened maybe before June 11th. The police have arranged for the relevant workplace to undergo thorough disinfection. The places where the officers had meals or changed clothes and the vehicles used have also been thoroughly disinfected. Next question, the reporter at the front. I'm from Now TV. This morning, the Joint Scientific Committee recommended that for those aged 18 to 59, the interval between the first 2 doses of the BioNTech vaccine will be extended from 3 weeks to 8 weeks. Now, this interval is now much expanded. Back then, when the interval was first formulated, what factors were behind the consideration? And given this extension in the interval, the second question, the bar sector has been talking about the latest regulations. Are the authorities concerned about further outbreaks, larger outbreaks at the bars? And what's the CHP's take on the latest COVID situation? Thank you for the questions. The first, latest advice from the Joint Scientific Committee. On Thursday, the Joint Scientific Committee under the CHP, as well as the expert advisory panel of the Chief Executive, reviewed the risks related to myocarditis and pericarditis associated with the BioNTech vaccine. We looked at the latest scientific evidence, as well as the advice from the overseas regulators and the WHO. When the first 2 doses of the BioNTech vaccine are at 8 weeks, there will be a better immune response and a lower risk of myocarditis or pericarditis. So based on the latest scientific data and the advice from the WHO and other overseas health regulators, we have recommended that for those aged 18 and 59, we can extend the interval between the first 2 doses from 3 weeks to 8 weeks. For those aged 5 to 59, they can wait for 8 weeks before they take the second dose after getting the first dose. But for certain people, if they have considered the risks and their personal needs, and when there's an informed consent, they can also opt to get the second dose early by getting it 3 weeks after the first dose. The second question, the risks associated with bars. Now, they are high-risk venues. When people visit such venues, they are in a relaxed mood. They may take off their masks and have a drink and chat. There will be more interactions with other people. So these are venues with a higher risk. We had clusters at bars, and there could be large-scale outbreaks. And when outbreaks happen, 20 to 30% of the people there could get infected. Given these risks, the government has assessed risks in the days to come. For those visiting bars and nightclubs, the patrons will have to do a rapid antigen test. This measure is to prevent silent carriers from entering these premises, leading to further outbreaks. We continue to monitor the situation, and hopefully these measures can help prevent large-scale outbreaks at such venues. Next question. The gentleman at the back. I'm from Hong Kong 01. Now, for the cases at operations wing of the police, the first case was June 12th. It was 5 days until it was uncovered. Why wasn't this announced earlier? Were there special considerations behind this? There is news that the viral strain is similar to a mutant strain. The people involved had private gatherings among themselves. As for the cases at operations wing of the police force, we just gave you some details. 22 people are involved. The first case tested positive with a separate specimen taken on June 12th. But it was an isolated case back then. The other cases were found positive from 13th to 16th of June. As we became aware of more cases, we realized there was an outbreak. So we got in touch with the police to take follow-up actions, including disinfection. The people affected or the people in the same unit, that is, other officers, were also arranged to get tested. And then more cases were uncovered. For now, all the officers concerned have undergone RAT and the results came back negative. We will keep monitoring the situation to see if further cases are uncovered. officers are also been arranged to be quarantined, isolated, or quarantined. So far, no second layer transmission has been found. For this mutant strain, this is a strain found in the fifth wave, that is the BA.2.2, instead of a new subvariant. We continue to monitor the situation to see if there's a signs of an expanding cluster, and we will stay closely in touch with the police.
Next question, the one at the front, please. Good afternoon, I'm from Ming Pao. About homes, we see there are two residential care homes for the elderly with infected residents. Now, since the fifth wave eased, it's the first time that we have home residents getting infected. Were they vaccinated? How did they get infected? And then, for the Kwun Tong, Chen Ka, Shang Chen House, they is it the case that there was no infection before? Now, for many in the last wave, in the early part of the fifth wave, if residents became infected, they have to be isolated or quarantined. So what's the arrangement now? Now, Dr. Au said that in recent days there are a few elderly persons getting infected, but more younger people getting infected. Is it because the elderly people are not so socially so active? And since there are few elderly cases now, so can you assess the possible trend? And then for the Ho Man Tin site, construction site, there are 10 cases. So have you found out what's the means of transmission? Has it to do with the ventilation system? Now, for the residential care homes, there are two residential care homes with infected residents. In the first case, only one resident is infected. And this morning, in the RAT test, no one tested positive. And that includes both staff and residents. And for that particular infected resident, we've arranged for the resident to go into isolation. And then for all staff members and residents in the home, we've arranged a PCR test to see if there are other cases. In the second home, it involves, again, just one resident. But in this home, another one worker has also been infected. Now, for the resident, the RAT positive test result was on the 17th, and for the staff member, it was this morning. And so far, we do not know whether it's the worker who's been infected by the resident, or whether it's the worker who has been infected in the community and then passed on the disease to the resident. So we arranged for all staff members and residents of this home to undergo a PCR test to see if there are any other cases. In the past 2 weeks, we find that for most homes where cases were first found, they came from workers. So for homes with infected workers, we arrange for residents who are close contact to be quarantined. So far, we have not seen any major transmission. But it's only in two homes for the disabled where we have seen a few more cases. But of course, the risk going up, because if home workers become infected and then they go to work, it's possible that they would bring the disease to the home. So we are in close liaison with the Social Welfare Department, and we require all staff members and residents of homes to do RAT every day. And so we could identify cases early, and then we could isolate the cases and prevent further transmission in homes. So far, we have not seen secondary transmission. In the past 90 days, so far, we have not had any infection records. For the definition of close contact, usually if residents are infected, it will be residents in the same room or in the same floor in the same area if there are no rooms. And then the residents here, they will be classified as close contacts. As for workers, if workers are infected and during the infectious period, that is 2 days before the positive test result, they have more intimate contacts, such as feeding the residents, which involve taking off the mask, or bathing the residents, or carrying out incubation and so on. Then, in that case, those residents will be classified as close contacts, because we don't want the residents to pass on the disease if they are infected too. Now, usually, if they have been confirmed they have been infected within 90 days, and we won't classify them as close contact, because after the people are infected, they will be immune and they won't get infected for some time. The third question is about the age distribution. Now, I gave you some information just now, and it's to compare with, say, the peak of the fifth wave. You might recall at the peak of the fifth wave, at residential care homes for the elderly, there were more elderly residents infected. There are many homes that saw outbreak, and so comparatively speaking, more elderly persons became infected at the peak of the fifth wave. But now, in the past 2 weeks or so, there are fewer elderly persons getting infected. So it's possible we have seen this rebound because of the relaxation of social distancing measures, so that people resume activities, and so that's why there is a high chance of transmission. That's why it may involve people of a younger age. For the elderly, so far, we have not seen major outbreaks in residential care homes, but of course we pay close attention to that, because if the vaccination rate is not high enough, and if there are infection cases, then for the elderly persons who have not been adequately vaccinated, and if they become infected, then there's a high chance of death. For the Home and Teen construction site, we inspected the site yesterday. So far, there are 10 cases in this cluster. The earlier cases came from the same group of people who had meals together. After that, the staff were arranged to to undergo PCR tests, and they also do RAT tests every day. And then for new cases, it seems that there are no direct contact between the new cases and the earlier cases. But then they may use the same changing room. They work underground, so they will have meals in containers, and that's where they eat and drink, and so they will take off their mask. Now, for the changing room in the construction site, maybe the ventilation is not so good, and sometimes windows are not closed. They just keep the air conditioner on, so there may not be enough fresh air supply. And so if there are infected cases, then because of poor ventilation, it could help with the spread of the disease. And also there may not be enough hand washing facilities. We've made suggestions to the construction sites. Hopefully they will make improvements. Now, the site is closed now until we have PCR test results for all the workers. And we'll see if there are new cases before we decide whether the site could resume work. Next to the lady in white. I'm from cable TV. The BA 2.12.1 cases, they are not unlinked. What is the visit history, the travel history of that person? And then for the TMHK case, you say there are 2 cases in the same block. Are these units facing the same orientation? And police clusters case, how come you did not give any report today on your own? Have you tried to investigate the source of infection? Does this cluster of infection, have they been to bars, for instance? And how many have been listed as close contacts and that need to be quarantined? And do you have other new clusters?
Now, for the BA.2.12.1 subvariants, the 2 untraceable cases. The first case lives at Hoi Ming House, Hoi Lai Estate, where there's nothing out of ordinary in terms of what activities this person is engaged in. And this person lives in Sham Shui Po, visits the surrounding area. The family members are fine. That's a second person lives at Sorrento, Block 5 Sorrento. The two families are affected. One family, it's a family of 5. All 5 of them tested positive, including 2 children and a domestic helper as well as the parents. The other family lives in the same block on a different floor, involving one case. The 2 units share the same orientation, but they are on different floors. Well, it could be that some vertical transmission happened in the building. This building will be covered by compulsory testing notices to see if there are further cases there. This is a BA2121. The second question, the cases there in the police. Now, there are more than 1,000 cases reported every day. There are outbreaks large and small across the city. For the CHP, we try to maintain transparency. Our investigation focuses on the key areas and key groups in the population. For cases in schools and care homes, or those involving public figures, or the places visited by the public, such as restaurants and bars. When the outbreak happens, we announce such cases, and then we may even cover those cases in our compulsory testing notices so that members of the public become aware of these venues and they are alert to the outbreaks there. Now, for the BA2.12.1 subvariant cases or the BA4, BA5 cases, we also announce local infections of such subvariants. For the cluster in the police, this is a cluster at the workplace. Upon investigation, we found out that the officers involved did not have to interact with the public. So control measures have been implemented. The preliminary investigation suggests that they haven't been to meal gatherings or bars. The transmission may have happened at the workplace because these officers have to undergo physical training and they may have to take off their masks. Also, at the workplace, during meals, the officers may have taken off their masks. These could be some of the risk factors leading to the transmission. We recommend the daily RAT so that cases can be picked up when they emerge. Any other questions? That concludes our press briefing today. Thank you.